Dental care is very important for horses because their teeth are continuously erupting, coming into wear, and with the lower jaw narrower than the upper jaw, they create edge. And tall teeth and abnormalities affect the way they chew and affect the comfort of the horse when being ridden. Before I became a dentist, I worked for a show jumper for 10 years in Italy. I went to the American School of Equine Dentistry, which at that time had a course in Colorado. And after that, I went to another course at the Technical College of Agriculture in Nebraska, which is a vet tech program. And annually, I also attend continuing education and many courses where equine dentists and veterinarians get together to work together. From the front of the mouth, we have incisors, which are mainly for tearing and helping collect forage when eating. Next, we have canines, which in theory by the book are fighting teeth, which are kept nicely at a short length and rounded off so that they don't catch on the tongue or can be used if the horse was having an argument with somebody and bite somebody. The bit sits in this area here, which is called the bars. And if you notice that where my thumb is, it doesn't come in contact with anything. And even further back, if this was the bit, it would not be making contact with the teeth. There are certain factors that you can age a horse with, from what we call the cups, the stars, and something that's called Galvanine's groove. And all these factors are an ish. But just looking at this horse, we know he's in his upper teens. Certain teeth, like this one line that's in the middle of the tooth, it started at the top at 10 and 11, halfway at 15, all the way to the bottom at upper teens to 20-ish. Quote ish, because these are only markers that help you guesstimate the age of the horse. Dental health can affect their performance in two ways. One, if they can't chew and process their food, they're not going to be healthy and happy. And secondary, the horse needs to have a front to back motion of the jaw, what we call anterior-posterior movement of the jaw. If it has any tall teeth or sharp teeth, it would be restricting the movement of the jaw back to front and also side to side. The most common dental issue we see is sharp edges. With the lower jaw narrower than the upper jaw in the way they chew, they create edge, which when the bridle is on and tightened up, it can be causing discomfort to the horse when being ridden. Every horse is different, but as a general rule, most riding horses we see between 6 to 9 months, and most pleasure pets, retired horses, we see once a year. Let's have a look at this. Hang in there, buddy. There's a power tool with a very fine diamond burr. I can carefully reduce a tall tooth in a controlled manner. And if you look, it is actually that fine, it is not cutting my glove. And when a horse bites down on it, it has an automatic clutch that cuts out and causes no damage or harm to the horse. As a new horse, Moose, we've been told, is a little fussy on the bridle, so we're just having a simple check to see what's going on. And when I place one hand on top of the bridge of the nose and one underneath and check the movement of the jaw, it is going to the left and it is locked up going to the right. Just to see what's going on, we can see some exceptionally tall teeth. And hopefully you should be able to get a picture shortly once we look inside the horse's mouth. On this side you can see the permanent tooth at the very back and a retained baby tooth here in the middle. And coming around on this side, you can clearly see here is the permanent tooth here, the retained baby tooth here, which we have to pull now. And if the sedation isn't enough, the veterinarian will administer more. There's a few signs that we should be looking out for if a horse is having a dental issue. Whether there's changing in the way the horse is eating, which is called quitting, dropping the food. Quitting is when they roll the hay up because they're struggling to chew in a circular motion. Dropping the hay, being difficult in the bridle, or just numerous simple changes in rideability or eating habits. When I'm working with veterinarians, all horses are cooperative because they are sedated by the veterinarian for the safety and well-being of the horse primarily and the dentist secondary. And we can always complete what we start. That is what our job's about, giving the horse the ultimate grind to perform well, chew well, process, and be healthy. I actually have 3 camels and 4 zebras. There will be a book when I retire.